You're our family's hero. We're gonna remember you forever. Seriously. And then thank you for all the positive impact to give all of us. Sure. And then right now I'm like Larry was willing to live the, give the hand to other people, to tell them whatever he experienced, to share with whatever the experience with your hospital. And then we try to help more people, and then give them hope. And then it's not end of the world.
Activity or lack of activity mean it's dead, or that it's just dormant?
Lack of activity would mean most likely that it's dead, and particularly you have to put in all the pieces together. So if your Signatera is 0, if your PET CT doesn't show any active areas, at that point you're completely would be considered no evidence of disease. Mm-hmm. So you're what everybody calls NED, which is where you want to get to, because NED is your first step to cure, because you got to get NED first, got to get no evidence disease. Then you need to maintain no evidence disease for 5 years.
Yep. Yeah, I know it's a good long while.
It's right. Yeah. And so, and for patients, obviously every, during that 5 years, there's always that a lot of times also patients, they say that they didn't realize how bad they felt like before, like a patient has cancer, maybe the patient doesn't know they have cancer, but they have it. And then they get treated, and then after treatment they're like, oh, I feel like really good. So then they're thinking, well, I guess I was feeling bad and I just didn't know it.
Yeah, that could be.
Some patients tell me that they feel like they're in their 20s again, and I'm like, well, I don't. The immunotherapy stuff is good, but I don't know if it's that good. But I think what it is that they just have forgotten, and they probably were like slowly feeling bad, and it may have been over, a couple years time, and then that just was normal for them, and then they get their cancer treated, and that issue kind of goes away, and then they feel a lot better. So to them, it's like, it's in their memory, it seems like in their 20s.
Yeah. Don't hold back necessarily. People are dying unnecessarily.
Yeah. It's unfortunate. And even a lot of times, like, I think a lot of the patients, like if you talk to them and you explain to them, but I think a lot of times they don't understand it, and they'll think, oh, well, okay, this treatment is okay, but it's probably not that much better than this other. But I think they don't understand that it is a world of difference. I mean, there's not really anything close to it. I mean, now, like, pulsed electrical field is you're starting to get more of it in the United States, and we're sending patients who can't come to us, we'll send them to the doctors in the US that can do it. But to do pulsed electrical field without immunotherapy injecting the tumor is a big difference, particularly in advanced. But I think you could argue that almost all pancreatic cancer patients should go like a similar route that you went, where because this always comes up where some patients think, well, it's one or the other. It's not always one or the other. Like in your situation, you sort of were able to get the best of both worlds. You were able to get chemotherapy, you were able to get PEF and immunotherapy all together. So you got it all. And I think a lot of people, when you look at that and think, that makes a lot of sense. I mean, to not just say you got to do this or you got to do that, but to do it all. And for pancreatic cancer being challenging, we know that if you can add chemotherapy or you can synergize with the chemotherapy, you're going to get better results. You can go at it alone. I mean, we do have patients. Well, I think I mentioned to you, we had this one patient who she did not want to do chemotherapy at all. And she got a complete response with only immunotherapy. And she didn't even get ablation. She just got immunotherapy. But those are well, we don't see a lot of those. Most of what we would see would be patients who did chemotherapy, who failed, and now they're with us, but they have no chemotherapy options. I mean, no reasonable chemotherapy options. So.
Right. Sure. Yeah. Well, I think first of all, first and foremost, I think the results speak, right, and that's what matters most. I think when you first want to think something, right, is does this actually work, and are you getting results? And so I can clearly say myself, I've gotten amazing results even right from the first couple of treatments, and you could see the effect of the intratumoral immunotherapy working on the cancer itself now. And I'm fortunate enough now to be 6 months out, and we're talking about being in a state where the cancer could be dead, and just waiting to do a PET scan to verify where that is. And so I think results are important, and seeing that. I think the logic of the procedure of just injecting the immunotherapies and all of the enhancers and inhibitors that you do into the tumor itself, that just makes a lot of logical sense, rather than flooding your whole body with it, which can obviously, you don't get the same concentrations of medicine going to where it needs to go. So that's all just makes so much logical sense to do that. And then, the other thing that stands out to me, and with the people who accompanied me to your treatment facility in Cabo, was just the amount of care that you and everybody else at the facility at Hospital H gave. I think much more so than I think in most U.S. hospitals and facilities. And it's not just the physical medical care, just the spiritual or emotional caring. I mean, they actually care about you, and they give you the test results that you have back and say, okay, well, this is elevated. When you go back home, you should talk with your doctor about this, because most of the time, and I've had this experience, and other people I've talked to say, well, you've got an elevated heart rate. Well, don't worry about it. Mm-hmm. And I always wonder, well, should I really be worrying about it, or do you just not worry about it because I've got terminal cancer, and so it's not really an issue. But the people care and want you to be healthy and recover, and so I think that makes a tremendous difference as well.
I remember that quite well.
It is, and she wants to hear all these things. If you have another minute, I could just grab her. She would probably just love to see your face. Sure. Or something. Here, 1 second. Yes.
Hi.
I mean, I want your kids to grow up with Larry for forever. So, and that's what we do. So yeah.
Yeah, you're our family's hero. We're gonna remember you forever. Seriously. And then thank you for all the positive impact to give all of us. Sure. And then right now I'm like Larry was willing to live give the hand to other people, to tell them whatever he experienced, to share with whatever the experience with your hospital, and then we'll try to help more people, and then give them hope, and then it's not end of the world. And then a lot of people he reached to, they have kids, they have little kids just like us, and then I've been through whatever they have been through, and I don't want more people been through what I've been through, and then let them know it's not end of the world. There's a hope. There's a doctor can help you, and to keep alive. That's such a beautiful thing we've ever been through.
Thank you. Yeah.
To share his experience with your hospital, with your doctors, and then Larry's cousins come back with such a good praise of your hospital, with everyone such a professional attitude, just so good. And then they will share with their friends, their family.
Sure.
Thank you.
Here, have a good rest.
Thank you. God bless you, Dr. Jason William.
Thank you.
Thank you.